Hello and welcome to this session on first aid method and basic training. Let us begin with the session.
Let us now take a look at the objectives of the session. At the end of the session, you will be able to rescue breathing for an unconscious victim of different condition by following methods. Resuscitate the victim by Nelson's arm lift back pressure method. Schafer's method. Mouth to mouth method. Mouth to nose method. Cardiopulmonary resuscitation CPR. Perform treatment for stopping of bleeding. First aid is defined as the immediate care and support given to an acutely injured or ill person, primarily to save life, prevent further deterioration or injury, plan to shift the victims to safer places, provide best possible comfort, and finally help them to reach the medical center or hospital through all available means. The key aims of first aid can be summarized in 3 key points. Preserve life. If the patient was breathing, a first aider would normally place them in the recovery position with the patient leaned over on their side, which also has the effect of clearing the tongue from the pharynx. It also avoids a common cause of death in unconscious patients. Prevent further harm. Also, sometimes called prevent the condition from worsening or danger of further injury, this covers both external factors such as moving a patient away from any cause of harm and applying first aid techniques to prevent worsening of the condition, such as applying pressure to stop a bleed becoming dangerous. Promote recovery. First aid also involves trying to start the recovery process from the illness or injury, and in some cases might involve completing a treatment, such as in the case of applying a plaster to a small wound. ABC of first aid. ABC stands for airway, breathing, and circulation. Airway. Attention must first be brought to the airway to ensure it is clear. Obstruction or choking is a life-threatening emergency. Breathing. Breathing, if stops, the victim may die soon. Hence, means of providing support for breathing is an important next step. There are several methods practiced in first aid. Circulation. Blood circulation is vital to keep person alive. The first aiders now train to go straight to chest compressions through CPR methods. Now let us look at the procedure to prepare the victim to receive artificial respiration. Loosen the tight clothing which may interfere with the victim's breathing. If the victim is in elevated place, bring the victim safely to the ground level. Take necessary safety measures. Start artificial respiration immediately without delay. In general, avoid violent operations to prevent injury to the internal parts of the victim. There are various methods of artificial respiration such as Nelson's arm or lift back pressure method, Schafer's method, mouth to mouth method, mouth to nose method, cardiopulmonary resuscitation or CPR method. Now let us look into the procedure to resuscitate the victim by Nelson's arm by the lift back pressure method. Place the victim prone, that is face down, with his arms folded, with the palms one over the other and the head resting on his cheek over the palms. Kneel on one or both knees near the victim's hand. Place your hands on the victim's back beyond the line of the armpits, with your fingers spread outwards and downwards, thumbs just touching each other. Gently rock forward, keeping your arms straight until they are nearly vertical, and steadily pressing the victim's back as to force the air out of the victim's lungs. Synchronize the movement of rocking backwards with your hands sliding downwards along the victim's arms, and grasp his upper arm just above the elbows. Continue to rock backwards. As you rock back, gently raise and pull the victim's arms towards you until you feel tension in his shoulders. To complete the cycle, lower the victim's arms and move your hands up to the initial position. When the victim revives, keep the victim warm with a blanket, wrapped up with hot water bottles or warm bricks. Stimulate circulation by stroking the insides of the arms and legs towards the heart. Keep him in the lying down position and do not let him exert himself. There are some do's and don'ts that we need to take care of while performing the procedure. Let's look at these do's and don'ts. Nelson's arm lift back pressure method must not be used in case there are injuries to the chest and belly. Do not give the victim any stimulant until he is fully conscious. Next, let us look into the procedure to resuscitate the victim by Schafer's method. Lay the victim on his belly, one arm extended direct forward, the other arm bent at the elbow and with the face turned sideward and resting on the hand or forearm. Kneel with one knee on either side of the victim so that his thighs are between your knees, and keep your fingers and thumbs positioned. With the arms held straight, swing forward slowly so that the weight of your body is gradually brought to bear upon the lower ribs of the victim to force the air out of the victim's lungs. Now swing backward immediately, removing all the pressure from the victim's body, thereby allowing the lungs to fill with air. After 2 seconds, swing forward again and repeat the cycle, usually at a rate of 12 to 15 times per minute. Continue artificial respiration till the victim begins to breathe naturally. Avoid this method in case of injuries to the victim on the chest and belly region. Next, let us look at the procedure to resuscitate the victim by mouth-to-mouth method. First, lay the victim flat on his back and place a roll of clothing under his shoulders to ensure that his head is thrown well back. Tilt the victim's head back so that the chin points straight upward. Grasp the victim's jaw and raise it upward until the lower teeth are higher than the upper teeth. Maintain the jaw position throughout the artificial respiration to prevent the tongue from blocking the air passage. Take a deep breath and place your mouth over the victim's mouth, making airtight contact. Pinch the victim's nose shut with the thumb and forefinger. If you dislike direct contact, place a porous cloth between your mouth and the victim's. For an infant, place your mouth over his mouth and nose. Blow into the victim's mouth until his chest rises. Remove your mouth and release the hold on the nose to let him exhale, turning your head to hear the rushing out of air. There are some do's and don'ts that we need to take care of while performing the procedure. Let's look at these do's and don'ts. If air cannot be blown in, check the position of the victim's head and jaw and recheck the mouth for obstructions. Then try again more forcefully. If the chest still does not rise, turn the victim's face down and strike his back sharply to dislodge obstructions. Sometimes air enters the victim's stomach as evidenced by a swelling stomach. Expel the air by gently pressing the stomach during the exhalation period. Now let us look at the procedure to resuscitate the victim by mouth to nose method. Use the fingers of one hand to keep the victim's lips firmly shut. Seal your lips around the victim's nostrils and breathe into him. Check to see if the victim's chest is rising and falling. Repeat this exercise at the rate of 10 to 15 times per minute till the victim responds. Use this method when the victim's mouth will not open or has a blockage. Now let us know the procedure to resuscitate a victim who is under cardiac arrest by cardiopulmonary resuscitation, CPR. Check quickly whether the victim is under cardiac arrest by checking for the absence of the cardiac pulse in the neck, blue color around lips, and lay the victim on his back on a firm surface. Kneel alongside the victim, facing the chest, and locate the lower part of the breastbone. Place the palm of one hand on the center of the lower part of the breastbone, keeping your fingers off the ribs. Cover the palm with your other hand and lock your fingers together. Keeping your arms straight, press sharply down on the lower part of the breastbone. Then release the pressure. Repeat the previous step at least at the rate of 15 times per minute. Check the cardiac pulse. Move back to the victim's mouth to give 2 breaths, mouth-to-mouth resuscitation. Continue with another 15 compressions of the heart, followed by a further 2 breaths of mouth-to-mouth resuscitation, and check the pulse at frequent intervals. As soon as the heartbeat returns, stop the compressions immediately but continue with mouth-to-mouth resuscitation until natural breathing is fully restored. Place the victim in the recovery position. Keep him warm and get medical help quickly. To recap, we have learned to rescue breathing for an unconscious victim of different condition by following methods. Resuscitate the victim by Nelson's arm lift back pressure method. Schafer's method. Mouth-to-mouth method. Mouth-to-nose method. Cardiopulmonary resuscitation CPR. Perform treatment for stopping of bleeding.
So that's all about first aid method and basic training. See you in the next session.